Welcome to the Digital Triage video demonstration. This video demonstrates how FootFall supports the digital triage approach to dealing with patient requests. FootFall offers an online consultation and workflow system which allows patients, parents and carers to get the help from their practice in a way that works for them. FootFall allows GP practices to operate and manage patient requests effectively, to ensure patients are given the right care at the right time by providing patients with a variety of options to access the care they need. FootFall is a digital practice enabling patients to find the help they need online, through self-care information or consulting online with their practice. FootFall enables practice staff, GPs, nurses and healthcare professionals to do their job effectively, to complete the correct tasks relevant to their job role, to prioritise patients, appointments and reduce the amount of traffic into the practice. In turn, patients are only seen when necessary, and patients that need appointments are able to get them. Appointments are available with much shorter wait times, and patients are able to access information and contact the practice online on the go. FootFall supports a digital triage approach, whereby patients are encouraged to give detailed information of their medical problem online. Patients can submit a structured online form which is called an electronic request, rather than calling or visiting the practice. This reduces traffic into the practice and allows staff to work more efficiently. Once an electronic request is filled in by the patient, it will come through to the practice and be seen by the administration team, who will decide what needs to happen next. Can they deal with the request themselves, or does it need the attention of the secretaries or a prescribing team? Or does the request need to go to a GP, nurse practitioner or pharmacist? They're able to prioritise the requests and assign them to the appropriate members of staff for action. Doctors and healthcare staff are able to review assigned requests quickly and decide what action needs to be taken next. They can respond to the patient's message online, contact the patient by telephone, or ask the patient to come in for an appointment. Most requests are able to be dealt with via online message to the patient or a telephone consultation. This stops unnecessary face-to-face consultations, patients unnecessarily visiting the practice and taking an appointment which isn't required. It also means the wait times for appointments are reduced, and patients that require an appointment are more likely to be able to see their preferred GP in a shorter timescale. Patients will of course still call or visit the practice. In this case, practices should use an automated phone message to direct patients online. The message could include something like, "Did you know you can find help, request appointments and repeat prescriptions online via our website? We aim to respond to online requests within 1 to 2 hours." If after the message the patient stays on the phone, they are forwarded to a receptionist, who should also try to encourage the patient to use the online consultation. There will always be patients who are unable to or do not want to use the online system. In this case, the receptionist can create an electronic request on behalf of the patient by asking the same questions as the online form. This way, all patients get the same level of service whichever channel they use. An electronic request, whether it has been submitted online or in the practice, will go into the same workflow for an administrator to review. Let's have a look at how this could work for a patient using FootFall. Wherever possible, patients should be encouraged to see if there is another route to deal with their medical problem, for example by using the treatment room. Here patients have access to self-care advice, they can search for a condition, find a local pharmacist or minor injury unit. In cases where a patient has a problem that needs attention from the practice, they can visit the consulting room. Here patients have 3 options. They can search for their local pharmacist, request an appointment with a nurse or healthcare assistant, or get help for any health problem. In this case, we want to get help. Patients are taken to an emergency page where they are warned not to use this facility for something that is an emergency, and it gives some examples. We're going to select "I have none of these." At the top here, we have information which tells the patient the practice will try to respond within 2 working hours. We have an option to select who is completing the form, so it can either be completed by the patient themselves or it can be used by a proxy on behalf of the patient. The first question asks for a general description of the problem. Let's say as the patient we've had some pain in our knee which gets worse when exercised. The next question asks how long has this been a problem, which is useful for the practice because patients often forget to mention this. Let's say the knee has been occasionally painful for a couple of months on and off, but it's been getting more persistent over the last 2 weeks. Then we go on to questions that cover what is known as ICE. This is the patient's ideas, concerns and expectations. This helps the practice understand the patient's expectations and how they want the practice to help them. So what do we think might be causing the problem? Let's say we think it could be a problem related to the tendons. What are our concerns? My concern is I play netball and exercise regularly, and that I won't be able to play or exercise anymore. How would I like the practice to help me? I'd like a diagnosis and maybe some exercises or treatment to help. Then we have a question on how we would like the practice to deal with the problem and some options: online message, telephone or face-to-face. When a patient selects one of these options, the system will ask questions based on the option the patient chooses. If I select online, the next question tells us the practice may still need to call us or arrange a face-to-face appointment. If we select telephone, we're asked, are there any times today when we would not be free to receive a phone call? We're also told the practice might still need to send us a secure online message or arrange a face-to-face appointment instead of a telephone call. If we wanted a face-to-face appointment, we're asked again if there are any times we're unavailable, and we're told the doctors will decide whether an appointment is the best way to help us. And again, the practice may need to send a secure online message or call us. Next, we're given the option to see a particular member of staff who we feel would be best placed to deal with the problem. The next question is how quickly we feel our problem needs to be dealt with. Often the patient will recognise this isn't a particularly urgent problem, and this will help the practice to prioritise. Then we have some disclaimers, which the patient must agree to before they submit the form. The form cannot be submitted without a selection or agreement. Firstly, the patient needs to decide if they're happy to receive appointment reminders via text message. Then we have the terms and conditions, where the patient must confirm the problem is not an emergency and that their request won't be dealt with while the practice is closed. They also need to agree if their symptoms get worse or if they require immediate help, they will visit NHS 111 online or in an emergency, call 999. The patient submits the form and the form will go off to the practice dashboard. If we go to the dashboard now, we can see here the patient's request has come through. And if we open it, we see the form exactly how the patient has completed it. In a similar way, if a patient was to walk in or calls the practice, a receptionist will select patient forms from the left panel and choose which form is relevant to the patient query. If we choose the Get Help from the Practice form, which we completed earlier on FootFall, you'll see the form is exactly the same. The receptionist would complete this form by asking the patient all of the questions, submit it, and it will come into the dashboard. FootFall is the solution to digitalising patient requests. There is a huge benefit to both patients and the practice staff, ensuring better continuity and better solutions for healthcare. That concludes our session on digital triage. Thank you for joining us.